Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. We have a special guest with us today to talk about facility dogs. So welcome to the episode, Hannah. How are you?
Good, thank you. How are you?
Good. So tell us a little bit about who you are and what you do.
So I am a certified child life specialist. I work primarily in the pediatric ICU and in the pediatric burn unit. So my job is a lot of just psychosocial support for children and families when they come to the hospital. It's really overwhelming. Being in the hospital, doctors and nurses come in and out, and people say and do all kinds of things. And that can be pretty overwhelming for families and for kids as well. So my job is to help explain what's going on to kids in ways that they can understand, new diagnosis education in ways they can understand, procedure preparation, procedure support, end of life support, difficult conversations, and then normalization. So what would the patient be doing when they're at home? What things would they be playing with or doing, and incorporating some of those normal things into the hospital setting?
That's awesome. I actually didn't even know this was a job. You just think about it being like nurses and doctors, and you don't really think about like an advocate or, someone really helping the children other than, like a traditional social worker. But
Right,
that's
exactly.
awesome. So, I mean, that's got to be tough work, but it's got to be very rewarding and very fulfilling.
It is. I love it. I've been doing this since June of 2019. I got my bachelor's degree at Millsaps College in psychology, and then I got my master's degree in child life at College of Charleston.
Oh,
So I
cool.
work
Okay.
at University Medical Center Children's Hospital in Lubbock, Texas.
So tell us, how do facility dogs kind of work their way into what you do on a day-to-day basis?
So facility dogs, there are many hospitals that do have facility dogs, and most of a pretty good majority of these facility dogs, their handlers are certified child life specialists. Some can be physicians, social workers, pastoral care. But I know that a lot of child life specialists do have facility dogs. It's definitely a growing field for sure. I started my job in 2019, and in these surrounding hospitals like Cook Children's, Texas Children's, Dallas Children's, they all have facility dogs. And I thought, well, I think we should have one. So I started the process, wrote a proposal, and then reached out to Canine Assistance, where I got Sable from. And from start to finish, when I first reached out to Canine Assistance to getting Sable, it took about 2 years.
Okay. And so let's back up a little bit. So tell us a little bit about what a facility dog does.
So Sable facility dogs are an intentional part of a patient's treatment plan. So the interventions that I do with her are documented in the medical chart. I do a lot of mobility, especially in the burn unit. Patients who have surgeries or skin grafts and they need to get up, they need to be stretching their muscles, they need to be out and about, but they're hesitant to because of their surgery, but they'll walk with Sable. It really is just, there is a goal behind every interaction, whether we're getting a patient up to walk, we're having a difficult conversation, I'm helping a patient take medication, I'm preparing a patient for a procedure, and I'm using Sable as a model for those procedures. So she's really more of like in those interventions, whereas like a therapy dog, they do social visits, they do high and by visits, social support, social visits, and therapy dogs are volunteers. So Sable, she is an employee through the hospital.
Okay, and that's kind of where I was getting ready to go with this question was the difference in a facility dog and a therapy dog. So, a facility dog actually works for the hospital, and therapy dogs, just as a volunteer basis, they might make their rounds to hospitals and nursing homes and places like that, right?
Yes, yes,
Okay.
correct.
So, in order to have a therapy dog, or I'm so sorry, a facility dog, do you have to already work at the hospital, or can you like try to bring a facility dog in to work there even if you don't? How does that work?
So I started as a child life specialist and then I got Sable. There are some people though who do work at the hospital and they have a facility dog and then they relocate to a different hospital, maybe to start a facility dog program there, or they moved for whatever reason and so they took their dog with them. And that hospital does have a facility dog program. So I do have some colleagues who that has happened to them. They have gotten the facility dog from their hospital and they moved with their dog to a different hospital. I'm not really sure if there are people who have facility dogs and then they become hired with a facility, like if they're not currently with a hospital. And I just know this because with Sable's pack that she has to wear, it has the hospital's name on it. So I was already established there. And then if I were to move to another hospital, then I would just get a different pack with that hospital's name on it.
Okay. And so you kind of mentioned it took about 2 years. And so was that 2 years of you did paperwork and then you got Sable and then you got her trained, or how does the process normally work?
So it was in 2019 when I started to start my proposal to get Sable, and I did a lot of literature research on what does the literature say about facility dogs, what are the benefits, what are some interventions, how are they typically used in the hospital setting. I came up with frequently asked questions that the hospital leadership might ask me. I started reaching out to the community and asking for their support and telling them what I would be doing. But then, of course, at the end of 2019, COVID happened. And so a lot of what I was doing was put on hold. But in the midst of all of that, my hospital and canine assistants were working on a contract together. So Sable is technically owned by myself, canine assistants, and UMC. So there was a lot of behind the scenes work happening just with the contract between UMC and canine assistants. And then COVID just slowed everything down tremendously. And so once the contract was approved, I got community support. The hospital, the CEO of the hospital did approve to have Sable. And then from there, canine assistant, their facility dog placement coordinator, I had a Zoom call with her and she did like a pre-placement visit. To see where I worked, what the patient rooms look like, what my office looks like, conference rooms, hallways, the parking situation, what outside the hospital looks like for the dog to go to the bathroom. And so she was in that process too, was getting to know me, getting to know the units I work in, and the layout of the hospital. And from there, they started to work on what dog would be happiest with me, my lifestyle, where I live, the work that I do. And they actually matched me with Sable when I went to hospital recipient camp. So they had already, before I had gone to canine assistance to get Sable, they had already picked her out for me. And it was really cute because the first few days of going to get her, they would send me clues of her name. And so when I got to camp, it was this really cute reveal. We went through the clues again. They asked if I had guessed her name. And then they had already had Sable ready to go for me.
What kind of dog is Sable?
Sable is a golden retriever. She has just a hint of poodle in her from her mom's side, but she is majority golden retriever.
Okay. And then, so I was kind of thinking about this when you said you got paired with her. If you already have a dog, maybe a puppy, maybe a middle-aged dog, are you able to then convert them into a facility dog, or are you kind of required to just go that like therapy dog route? Do you know?
So the training is a lot different. Therapy dogs are any dogs that can pass a basic obedience test. Sable started her training when she was 4 days old, and she was trained and did a lot of her healthcare experience work with Children's Healthcare of Atlanta, and she had a foster family, and so the canine assistance group, their philosophy is a bond-based teaching, and so it's a lot of the bond that you have with your dog. Essentially, you're trusting your dog to make good decisions, and your dog is trusting you to put them in a situation where they can be successful. So Sable's training was about 2.5 years long of just extensive hospital training, socialization, wearing her pack, socializing with others, with kids, with people of different ages. I know that I don't really know of people who do have dogs and then they turn them into facility dogs just because the training is so extensive and it is so long. I know that people do have dogs and they go the therapy dog route and they go through obedience testing and then they become a therapy dog.
Right. Yeah, that makes sense. I didn't realize that she needed that much training, but in consideration of what she's helping you with and being an employee of the hospital, like that definitely makes sense. And you mentioned they were trying to figure out if she was a good fit for you. So, I mean, do you know kind of like what they're looking at, like their characteristics with respect to what dogs would be good for particular facilities or particular units?
So my job working in critical care, it's an inpatient setting. And so a lot of the kids who I see are there for an extensive period of time and they're really, really sick. I don't really see, I will see some like oncology patients in our cancer center and inpatient. But typically my job is long-term patients who are really, really sick. And so it's all of sibling support, family support. And they knew that this was my population, and my population is not like in the operating room in the emergency department where we're room to room to room to room. We're prepping, we're going, we're moving, we are seeing patients back to back to back. And so they wanted me to have a dog who is okay hanging out in a patient's room for a while. She doesn't have to go from room to room, and that is the only way to make her happy is if she's constantly going. Sable will get on a patient's bed and she'll take herself a good nap. And she's totally happy doing that. She's totally happy getting to know patients for a while for a long-term stay. So they really considered too, is this dog going to be happy working with patients who are here for long-term, or does this dog need to be more of like in a fast-paced environment?
Yeah, that makes sense. And again, more things that I didn't think about. I just kind of think about the patients who are just, in their room, the dog drops by, not even taking into consideration that there could be facility dogs in that faster pace, room to room to room. But it makes perfect sense. So the next question I kind of have for you is what kind of expenses did you face getting a facility dog, or did you not face any since the hospital was somewhat involved?
So Canine Assistance is a nonprofit organization, and so they will take, whatever money. There was really so essentially it was no cost to get her, but they'd accept any payment for her that would ensure another facility gets a facility dog. So they kind of have like a pay it forward program, but they're amazing. They are phenomenal. They just really do such good work, and they have been doing this for over 25 years. And it's just really they teach the dogs who change the world, and I definitely believe that. So there was Also, just expenses of just like food and vet and just her accessories and her daily needs and the things that she needs. The Lubbock community has just surrounded us and loved us and have poured into us and have supported us 100%. So we're so thankful for their support and just for the Canine Assistance organization and how they run their operation. And so we did give them money to ensure that another hospital would get a facility dog in the future.
Oh, that's awesome. I'm going to have to look them up. I haven't heard of them before, but it sounds like they're doing amazing work. And obviously, we could probably use facility dogs in every hospital.
Yes.
So, kind of on that note, and the last question for you is if someone is working at a medical facility, a hospital, what steps would you encourage them to take to get a facility dog where they work?
Definitely have support through your management and leadership team and the higher ups in the hospital, definitely having their support, but definitely doing your research too. Going to your leadership, but also backing everything up. When I went to our leadership team, I did not leave one rock unturned. I had every question that they could possibly think of. I already had an answer for it. So making sure that when you go to your leadership team, having their support, hospital leadership support is huge. They are the ones who are ultimately going to be making the decision of if the hospital does get a facility dog. And so coming to them and leaving no stone unturned, having every question that they could possibly think of, already having an answer for it. So really doing your research beforehand, so the hospital can make an informed decision of getting a facility dog. And that part takes a lot of work, just coming up with that general proposal, but then also having the support from your community too. So I really think that the support from management and leadership, but also giving them what they need too, in terms of making this decision, that is huge. And then once you have their support, then moving forward is super easy and it's super fast. And it feels like, everything that I did to get Sable is so worth it. So I really think it's all comes down to the support of the hospital.
Yeah, that's awesome. I really appreciate you taking time to kind of teach us about facility dogs because what the listeners don't know is when we initially reached out to Hannah, we thought we were talking about therapy dogs. And she's like, no, therapy dogs are different from facility dogs. And that in and of itself was a lesson. So we just really appreciate you being a guest on the podcast today and just teaching us about facility dogs. So thank you so much, Hannah.
Well, thank you so much for having me. I love talking about the work that we do. I love having a facility dog. It has changed my life professionally and personally. I've had Sable, and we just hit our 1-year anniversary together. So,
oh, that's awesome. I love that.
A lot of work, and I can't imagine doing what I do without her. And I don't know how I did do what I did without her.
Right. Well, thank you so much for putting in all the hard work. And, you're definitely making a difference in people's lives every day because of the work you and Sable do.
Oh, thank you. Thank you. I appreciate it. We love what we do. That's definitely for sure.
All right, Hannah. Well, have a good night. Thank you.
Thank you. You too.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.